Hey everybody, Michael Lepore again here, coming to you on Whiteboard Wednesdays. We're going to talk a little bit about varicose veins. Some people say, I'm not really sure if I have them. What is one? How do they compare to spider veins? What's the difference? So we're going to talk about that, as well as some of the ways that we treat varicose veins. So if you've ever seen somebody walking around with those kind of ropey looking or worm looking structures on their legs, those are varicose veins. They can be any size. They can be very large, they can be smaller, and some people just get them because they run in the family. Mom had it, dad had it, grandma had it, and some people get them because of the way their veins actually function, which we'll talk about in just a second. The difference between a varicose vein and a spider vein is, if you've seen those veins that literally look like little thin spiders, they're not raised and they're usually dark. Those are spider veins. They're cosmetic. We typically treat those with sclerotherapy or laser. Varicose veins are different because they're raised. The great saphenous vein, which runs on the inner aspect of the thigh, it's the vein we use for bypasses on the legs for limb salvage, or the cardiac surgeons use on bypass on the heart for coronary artery bypass grafting. That vein can get enlarged, so much so that it's not even usable for a bypass. And then the veins that are draining into that vein, they get the back pressure because the flow's going in the wrong direction, and that vein then dilates. As the vein dilates, it can cause aching, burning. Patients may complain their leg almost feels like a toothache, or it's heavy. Many times we can put patients in compression therapy for a period of time, and it makes their leg feel better, which tells us that that's probably causing the problem. But as soon as the compression stocking comes off, the pain is back and the varicose veins aren't going to go away. So then we think about treatment. An ablation, where we actually go into the vein using ultrasound techniques to use a tiny needle and get into the vein and deliver ultimately a device that closes the vein from the inside with heat, either laser, radio frequency, sometimes sclerotherapy, meaning we inject material into it. There's different ways to do it. The vein gets closed, so the back pressure's gone. And then once that's done, the varicose veins that are dropping into these or being caused by that, we remove by a procedure called microphlebectomy, where we wear these very high power scopes on our eyes, make a tiny little nick in the skin, and remove the veins completely so they don't develop clots in them. So varicose veins can cause pain, they can cause swelling. Phlebitis, which is clot in the vein, is considered a symptomatic varicose vein, and that can be painful and cause trouble and lead to a DVT, or a deep venous thrombophlebitis, and maybe even a pulmonary embolism, which is blood clots to the lung. And sometimes they're just cosmetic. People just don't like the way they look, and they would like them removed. And that's okay too, because there's nothing wrong with that. Bottom line is, varicose veins are not an uncommon phenomenon. They're around. I explained to you already in summary that they are the ropey looking veins on patients' legs, and they can affect anybody in the population. There's certainly ways we can treat them, either by compression initially to see if a patient's a good candidate for treatment, and then ablation and possibly removal of the symptomatic varicose veins themselves. I appreciate your time and listening to me today at Sarasota Vascular Specialists, Whiteboard Wednesday.